Good afternoon. I'm pleased to be joined virtually this afternoon by Minister of Health Jason Kenney and in Edmonton, Dr. Hinshaw, Dr. Yu from Alberta Health and Alberta Health Services to offer an update on the situation in Alberta with Omicron and COVID-19. I have some good news to share, but also a word of caution. The good news is that there are some early indications that Alberta has reached and surpassed the peak of infections in our province. It's still early days, but we can see that in of the 19 communities where we are doing wastewater analysis, we have seen in those samples and studies that Omicron and Delta our COVID-19 are declining in 15 of those 19 communities, most importantly with apparently significant declines as of January the 16th in Calgary and Edmonton, the two areas most who were earliest hit by the Omicron wave. So that's encouraging. There are still 4 of the 19 communities where trends are suggesting through wastewater an increase in transmission. But let's recall that Omicron did not affect all regions of the province simultaneously, so we can expect to see some regional variances. We've also seen some evidence of stabilization and decline in the PCR tests that confirm positive for COVID. A week ago today, we were at a positivity rate of 41%, and for yesterday, we're reporting 33%. We'd obviously like to see that trend continue, but what we do know looking around the world is that the Omicron waves of transmission have typically peaked about 4 weeks after they began. And here in Alberta, we went past the 50% of our COVID-19 cases being identified as Omicron variant on December 16th. So we're now exactly 5 weeks from that point, really 5 weeks from what we could define as the onset of the Omicron wave in Alberta. So if the virus, if the variant performs in Alberta like it has in jurisdictions all around the world, we can reasonably expect that we may now be beginning on the downslope of transmission. Having said that, there continues to be growing pressure in our hospitals, and we have to be very mindful of that, particularly in non-intensive care beds. So regular ward beds, we now have a little over 1,000 patients admitted either for or with COVID in those beds. Now, we have been doing a more detailed data analysis of those admissions to determine what percentage of those patients were admitted for COVID as their primary cause of hospitalization versus those who were incidental cases who were admitted and then subsequently tested positive but are typically asymptomatic. And basically what we're seeing over the past week or 10 days is that 45% of the non-ICU COVID hospital patients are incidental cases. The COVID is not the reason for their hospitalization. About 40% are primary COVID patients. They were admitted primarily because of COVID, and then a small percentage are admitted where COVID is not the main, but is a contributing factor. They may have a chronic condition that is worsened potentially by COVID. So that is, I would say, some good news. Now, a word of caution: even if a patient who is asymptomatic for COVID, who is an incidental COVID patient, is admitted to hospital and they subsequently test positive, they do need additional treatment protocols, isolation. Staff have a different standard in terms of personal protective equipment. So those cases can add marginally to the pressure on our hospitals. More on the good news side, though, I think partly because of the significant number of incidental COVID cases in non-acute care beds, we've been quite stable at around 6,300 total non-ICU patients in Alberta's 100 hospitals. Those are about 1,000 COVID and 5,300 non-COVID patients in ward beds. And that has been pretty stable for the past week or 10 days, meaning that we're operating at about 89% of total capacity across our healthcare system. Now, I know Dr. Yu will hasten quite rightly to point out that that is an average and that some of our hospitals, particularly in Calgary and Edmonton, are much closer to 100% and are quite heavily burdened. And I think based on the velocity of growth, we do know, of course, there will be a lag between the peak in infections and the peak in hospitalizations. probably something in the range of a 2-week lag. If we judge from many other jurisdictions, they haven't all performed identically, but that would seem to be a reasonable expectation of about a 2-week lag between the case peak and the hospitalization peak. So I think we can reasonably expect to see 1,500 or more COVID patients in non-ICU beds when we reach the hospitalization peak a little later in January. Again, many of them will be incidental cases, but still, with many healthcare workers having to take time for self-isolation themselves, all of that will add significant pressure to the healthcare system. I should add that fortunately, the pressure really is being experienced in the non-ICU side of the healthcare system. As we expected, we are not seeing significant additional pressure on intensive care, as we did see during the Delta wave. This has been a common experience, particularly with highly vaccinated countries or countries with high levels of population protection with respect to intensive care. So we have a little over 100 patients in intensive care with COVID. The last time I saw an analysis about a week ago, about half of those were still Delta patients who have been in hospital for a long time. So a relatively small number of Omicron patients, and about 30% of our ICU patients were admitted for reasons other than COVID. COVID is an incidental finding for them. Again, pressure certainly at over 200 total patients in ICU, something we have to keep a very close eye on, but not the huge kind of pressure that we were facing on intensive care during Delta. And so because of the expectation that we're going to see potentially hundreds more non-ICU patients in our hospitals diagnosed with COVID, we are announcing today a number of strategies that we have worked on as contingencies if we reached a significant pressure point. I'm going to outline those, and Minister Copping, Dr. Yu will detail these strategies. First of all, we are building bed capacity in both non-ICU and in ICU settings. Existing beds are being allocated for COVID care, and additional beds are being opened in some locations as needed. And starting January 24th or sooner, some beds in our pandemic response units will be opened These are units that we prepared earlier in the COVID period for essentially overflow capacity if necessary, and they will be there really to deal with patients who are ready to be released from hospital, but they may need some additional monitoring. They won't need significant intensive care, but it is an additional measure that we are taking just to be ready should we get a huge number of non-ICU patients in our hospitals. And one additional thing I should point out, we are seeing a much shorter period of hospitalization for COVID-diagnosed patients. In Alberta, in Delta, we saw the duration of hospitalization at about 10 days. AHS is now reporting that at about 5 days. Many other jurisdictions are reporting an average period of hospitalization with COVID Omicron at about 3.5 days. So that is also helpful in terms of managing capacity. The second strategy that we are announcing today is implementing a community response plan through which Alberta Health Services is closely working with primary care networks to provide community resources for those managing the illness at home, as the vast majority of COVID patients do, well over 95%. So AHS and our PCN partners have opened or are planning virtual call-in lines or COVID clinics in select communities that will be available to screen, assess, and appropriately direct people with mild and moderate COVID-19 symptoms. This is really important because in some other jurisdictions we've seen that a large number of people coping with COVID who may not require hospitalization and certainly don't require intensive care may have minor symptoms, but they're showing up, they're looking for tests, they're looking for a diagnosis, they maybe need some kind of modest intervention. And so we want to avoid having large numbers of those people go to emergency wards if they don't have to go to emergency. And so I want to thank the family doctors who across the province participate in these primary care networks for their flexibility in stepping up and helping us to create these community clinics that can relieve, hopefully, some of the current pressure from our hospitals. The third strategy that we're announcing today to maintain capacity is to maximize the availability of the workforce to support patient care. And through this, alternative team-based care models are being implemented across the province as necessary. This means that instead of individual healthcare providers caring for a smaller number of patients, a team that together has a complete skill set and relevant experience collectively cares for a larger group of patients. And I can say that over 600 nursing students have joined the AHS team and will work and get educational credit for assisting through this wave. So I want to thank AHS and everybody that works there for helping to roll out these strategies to cope with Omicron. Let me say, as an update on schools, I'm glad to report that we only have 6 out of the 2,400 K-12 schools in Alberta that have had to shift to online learning as a result of COVID right now. And that's a great credit to parents, teachers, staff, administrators, our partners in the school boards, everybody, Alberta Education, that's been working on this to see only 6 of 2,400 schools that have had to move to online instruction. And it means basically 99% of our schools are operating for in-classroom instruction and doing so safely. We know it's been challenging. We know with staff, many staff on isolation, on sick leave, many students having to stay home. It has been challenging, no doubt about it, but just thank you to everybody for your flexibility and patience. And I know many parents are frustrated in some schools not yet to have received rapid test kits. I'm told that the vast majority of schools have received the test kits that we committed to, but the reality is that we are facing a massive global shortage in these rapid antigen test kits. To date, Alberta has distributed 15.3 million tests. Now, typically they come in packages of 5, but that's 15.3 million tests since they first became available. And as you know, we became impatient with delays from the federal government's promised deliveries of rapid antigen tests. And so we went to market in mid-December to procure 10 million rapid tests directly by the province. Unfortunately, we've been running into the same global supply constraints and just general problems with supply chains around the world. In fact, I'm told by our Department of Health that one major U.S. provider with whom we signed a contract had the U.S. federal government come to them about 10 days ago and order 1 billion tests, and basically to say, use force majeure to say that we take precedent over all international orders. So we are starting to see, we talked a year ago about vaccine nationalism. We're starting to see that same kind of protectionism or nationalism when it comes to these rapid tests. I think this underscores, once again, the need for us here in Canada to onshore production, development of vaccines, of therapeutics, but also equipment like tests of this nature. It also underscores what I've been speaking about since April of last year, the need for Health Canada to accelerate the approval of additional rapid tests. As I keep pointing out, in Europe, over 100 different rapid antigen test products are available on the market, but we only have a handful, I think 6 or so here in Canada. And so we are much more vulnerable to these supply constraints as a result. So once again, we urge, as all the premiers have done, we urge Health Canada to get with the program, to use emergency youth authorization protocols to approve these tests. These are tests, after all. They're not medical interventions. And I think it's reasonable that if something has been deemed safe and accurate for use in the European Union, it should be that should count heavily in the favor of applicants for approval by Health Canada. And so please, to Health Canada, let's get these more tests approved so we can get them in the hands of people. We are expecting, although I say this with some caution because of all the delays we've experienced, we're expecting about 8 million tests to be delivered this week and next from our own Alberta government procurement, and another 1 million that the feds promise us. Now, those will be used for priority populations, including the schools, for school kids, long-term care workers, First Nations that have been more challenged by COVID, for example, and other higher priority groups. Unfortunately, it's going to be a while until we get access to enough tests to once again make them free on a large scale to the rest of the country, to the rest of the province, excuse me. I said the rest of the country because I just got off a phone call with all of the premiers through the Council of the Federation. I want to underscore that we have reinforced our collective solidarity to demand a very significant increase in federal funding for healthcare through the Canada Health Transfer. I think what all Canadians, regardless of their political perspectives, are coming to terms with in COVID is that these capacity challenges that we have been experiencing, where Canada's healthcare system has been had far fewer beds, quite frankly, to field than most other developed countries. That points to some very serious issues in our healthcare system. And even though here in Alberta we have the most expensive health system in the country, even though we added $900 million to the baseline budget of health last year, and I can tell you we will be adding more to the budget for healthcare this year, even though we've put in nearly $3 billion in COVID contingency, even though we have more nurses and doctors working in Alberta than at any point in our history, and we're spending more on healthcare than at any point in our history, we have still struggled to cope with the capacity constraints posed by COVID. And that is just not acceptable. The provinces are funding 78% of healthcare costs, and the feds are funding 22%. And so the provinces are, when it started, Medicare was supposed to be a 50-50 deal. Now it's a 3-to-1 arrangement. And so our united demand is for a 35% federal portion of health funding. That would increase Alberta's share of the Canada Health Transfer by about $3.25 billion. And that could make a huge difference in our ability to avoid the kind of capacity challenges we've been facing here. I also want to speak to a couple of other issues involving COVID and the federal government. One is with respect to the quarantine for truckers that is being imposed for those who are unvaccinated. Now, I understand vaccine mandates for workers in certain occupations, and indeed we have done that ourselves in Alberta Health Services and Alberta Public Service with an option for regular rapid antigen testing. But I think we need to apply these policies with a heavy dose of common sense. And common sense tells us that we are at the peak of supply chain constraints across North America, around the world, huge inflation, and we can't afford to lose potentially thousands of truckers on our roads bringing groceries up from the U.S. and who knows, maybe rapid test kits as well. And so the federal government brought in a delay of a few months on this quarantine requirement for unvaccinated truckers who cross the border. I would just say, please extend that. Use some common sense. I don't understand why we would be so rigid about this. And similarly, on the requirement that they have now for PCR tests for travelers arriving on airplanes from abroad, those travelers already have to prove that they are fully vaccinated. They have to have a negative PCR test before they board the flight. They have to go through a symptom test. Many of them would have taken had gotten a negative PCR test shortly before traveling, not long ago. And so to add an additional burden for really no measurable positive public health effect makes very little sense to me. Again, please, I say to Ottawa, use some common sense on this. We have right now several million Canadians with current active Omicron infections. We will have several million more as the country comes down the curve. Testing asymptomatic people twice, fully vaccinated asymptomatic people twice, creating lineups in airports, which could be a vector of transmission, makes no sense. So my plea to the Government of Canada is on things like the quarantine for international truckers and these arrival PCR tests, please apply some common sense. Let me just close with, I started with the word of optimism, but guarded optimism, I should say. there's I know a lot of people are saying to me and to the government, rightly, understandably, when are we going to get out of this? You see the United Kingdom that is dropping almost all of its COVID restrictions, or will do so shortly. The Scottish government, that was the UK government for purposes of England. The Scottish government announcing that they believe they went too far in some of their policies, did not help to diminish spread. Spain and Portugal are talking about a radical change in approach. Other jurisdictions doing the same thing. So we're being asked, when do all of these restrictions and measures come to an end? And my answer is hopefully soon. But we have to get past this Omicron. We've not yet reached the peak in hospitalizations. We have to support our healthcare workers. So if you're frustrated, I get it. We are all frustrated and tired of this thing, sick and tired of it. But please, in your frustration, think about the hospital workers who day by day are seeing more patients show up. They are working incredidly hard to keep people safe, to save lives, and so let's be mindful of them. But in the midterm, I did see a really interesting editorial published this week in The Lancet, the prestigious British medical journal, and I just want to quote from this, from Christopher Murray, quotes, "The impacts of future SARS-CoV-2 transmission on health will be less in the future of broad previous exposure to the virus, regularly adapted vaccines to new antigens or variants, the advent of antivirals, and the knowledge that the vulnerable can protect themselves, ensuring that future waves will be much less impactful. COVID-19 will become another recurrent disease the health system and societies will have to manage. For example, the death toll from Omicron seems to be similar in most countries to the level of a bad influenza season in Northern Hemisphere countries. After the Omicron wave, COVID-19 will return, but the pandemic will not." I certainly hope that The Lancet is right about that. We're not there yet. And so, folks, just please continue to be diligent, be careful, think of our healthcare workers, and let's just get through this. Thanks very much. And with that, I'll invite Minister Copping to say his remarks. And let's just get through this. Thanks very much. And with that, I'll invite Minister Copping to say his remarks.
Great. Thank you so much, Premier, and good afternoon, everyone. I'm pleased to join you virtually today. As I advised on Twitter on Monday, I tested positive for COVID-19, and I've been isolating at home since I developed symptoms. It's what we ask of every Albertan, and I want to thank everyone who has done their part by following the rules to help reduce the spread of COVID-19. We know Omicron is highly transmissible, far beyond anything we've seen up till now. None of us wants to be responsible for giving COVID to someone who is at high risk or works or lives with someone who is. Since becoming health minister, my three priorities have been building immediate capacity in the health system, increasing vaccinations, and preparing our health system to respond to more effectively large-scale health crises such as COVID-19. Now, if anyone still doubts the risk that Omicron variant poses, as the Premier just laid out, we have reached the highest number of hospitalizations with COVID-19 ever. Now, recognizing that Omicron is so widespread, and as indicated by the Premier, we are tracking those who are hospitalized for COVID and those who are hospitalized with COVID. Currently, approximately 55% of new non-ICU admissions and 70% of new ICU admissions are directly due to COVID-19. The remainder are patients with COVID-19 that is related to the admission. While these individuals may not be directly receiving treatment for COVID-19, it's important to note that they require extra care to ensure transmission does not occur, which requires more resources in the hospital. But the distinction still matters. We need to know when COVID is a direct reason for admission, so that we can make a better estimate of the impact and severity of the virus, and so we can better plan for the resources we'll need to serve Alberta patients. We've worked hard on that planning, and we need to keep adapting as the virus changes. As Dr. Yu pointed out in an op-ed published earlier this week, any Albertan with COVID-19 who has needed admission to hospital over the past 2 years has received it. That, despite the immense pressures that COVID-19 has put on our system. And as the Premier said, we are working with AHS on three main areas to ensure the healthcare system can continue to respond to the growing needs that are a result of Omicron: increasing bed capacity, implementing a community response plan, and maximizing the availability of the workforce. Now, Dr. Yu will speak more in detail on this in a moment, but my message to you and to everyone watching today is that we will be ready. In addition to ensuring our healthcare system is ready, we are also relying on rapid tests to help reduce the spread. We're working to maximize the supply of rapid tests in priority settings like healthcare facilities, continuing care shelters and schools, and continuing to distribute as many as we can to the broader public as supply permits. While access to rapid tests can help to give many symptomatic Albertans knowledge and some peace of mind as well, its greatest impact is helping people to quickly know that they have COVID-19 so they can start isolating even if they're not showing symptoms. That's why we're doing everything in our power to ensure we have a strong, steady supply of testing kits coming into the province and getting into the hands of Albertans as quickly as possible. And I'm pleased to report that despite the delays in receiving rapid test kits from Ottawa and our own manufacturers, as mentioned by the Premier, we have now shipped the vast majority of the tests and masks promised to schools. We're also expecting 3.5 million rapid tests from our own direct procurement this week and an additional 4.5 million next week. Additionally, the federal government has confirmed shipment of 1 million tests this week. All of this means that we should be in good position to begin the second distribution of tests and masks to schools next week as planned. Subject to additional availability of supply, we'll continue shipments to pharmacies and AHS sites. However, it may be towards the end of the month before significant additional tests are available for broad public distribution. Throughout the pandemic, Alberta has had a strong rapid testing program. Before providing tests to the general public in December, kits have long been available through our employer and service provider program. I would like Albertans to be sure that as we contend with supply delays, and this is happening around the world, we continue to prioritize the supply of workplace tests to those who care for our most vulnerable. This includes healthcare workers and mobile outbreak units, as well as long-term care, designated supported living and hospice facilities, primary care, child care, and community services that look after vulnerable populations, including shelters and residential treatment facilities. We also need Albertans to continue to do their part, and the single best way they can do that is to get vaccinated against COVID-19. The vaccines work against the Omicron variant, especially third doses. There's been a steady uptake of booster doses, with nearly 39% of Albertans aged 18 and older stepping up to get their third dose since we started administering boosters for all adults a month and a half ago. That's good, but we need to get this rate higher. As COVID-19 has proven time and time again, we can hope, but not assume, that this is the last COVID-19 variant that we will see in Alberta. And vaccinations still remain the best way to provide protection so that when the next variant comes, it is far less likely to pose a serious threat to us or the capacity of our healthcare system. And that's why we're still strongly encouraging Albertans to get all of the doses they are currently eligible for. I also believe Albertans need and deserve support as they continue to make decisions about vaccination, no matter if it's their first or fourth dose. This week, Alberta's Vaccine Hesitancy Advisory Committee held their second virtual meeting. This group will advise on how we can improve immunization rates among those who are hesitant to get a COVID-19 vaccine. I look forward to working with this diverse group of health professionals, youth, Indigenous health directors, community leaders, and academics as we continue to look for ways to be able to get information to Albertans and increase the rate of vaccinations. Now, the Omicron wave, as indicated by the Premier, is once again straining our health system, although differently from the fourth wave. Omicron so far does not threaten our ICU capacity in the way that Delta did. Instead, it's straining our hospitals more broadly. We know the numbers will continue to rise from the cases we've seen in the past few weeks. We know these cases will peak and will come back down, and hospital admissions will come back down with them, but we don't know exactly when. The one thing that is certain is that the next few weeks are going to be challenging. We need to focus on the task at hand, which is to support AHS and our healthcare workers to care for the continuing surge of patients who need care in hospital. I am grateful to everyone working in our hospitals and across our healthcare system from EMS to labs to family doctors' offices to our home care and continuing care providers. We need all of you. And we know you're tired. You've been through this for over 2 years, and you need to get back to caring for patients in a more normal fashion. And we all need to get back to living more normally. And we will get there. We'll get there with the support of 4.5 million Albertans who continue to protect each other and the healthcare system by getting vaccinated and following the public health rules. It has been a long 2 years, but as indicated by the Premier, we will get past this wave. So I want to thank everyone for doing their part. And I'd like to invite Dr. Bernard Yu from AHS to come to the podium and speak more specifically on our plans to be ready for the next surge.
Good afternoon. We're once again facing significant and increasing pressure on our healthcare system. While we have successfully faced down other waves, the speed at which Omicron is spreading through Alberta and around the world is concerning. In the past week, we have seen hospitalization numbers increase sharply. Provincially, the number of patients with COVID who require hospital care has increased by about 40%. While for some, the health effects of Omicron may be milder than the other COVID strains, the impact on patients, their loved ones, the healthcare system, and healthcare workers is significant. As the Premier said, there are currently 1,131 Albertans in hospital with COVID-19. And this week, we reached numbers of total hospitalizations with COVID that is higher than at any point during the pandemic. Fortunately, the number of Albertans in ICU is still well below the total number of ICU patients that we cared for at the peak of the fourth wave, which was 313. Despite the somewhat positive news, we are seeing signs that our ICU teams can expect to see more patients needing their care in the coming weeks. In the past 7 days, the number of patients with COVID-19 in our ICU has increased by about 18%. Our EMS and emergency department teams are also facing volume increases of as much as 30%. Calls to HealthLink are up by more than 300% compared to pre-pandemic times. The recent surges in hospital and ICU cases, coupled with the fact that we are seeing more of our own healthcare workers become sick or have to quarantine due to isolation requirements, means that our healthcare system is facing yet another serious challenge. I want you to know, though, that I have every confidence that we can meet this challenge. I know this because of the incredible dedication of our staff, physicians, and leaders who have and will continue to give everything they can to help Albertans get through this relentless pandemic. And we are beginning to see signs that we may be reaching the anticipated peak of cases. One thing is clear, the current wave is having a very different impact on our healthcare system than those previous. This is not another wave affecting only the unvaccinated, such as Delta Wave 4. While the risk of hospitalization and severe outcomes is lower if you're fully immunized, we are still seeing breakthrough cases. This really highlights the need for everyone to follow public health measures, stay home when not feeling well, wear a mask in public places, and remain vigilant at all times. It has been a long 2 years, but now is not the time to let your guard down. It also highlights the importance of the booster. Evidence is really clear. People with a third booster are much better equipped to fight the virus, and should they contract the virus, they do not seem to get as sick. And while the pressure on our EDs, acute care beds, and ICU is increasing, this wave appears to have the most significant impact on our emergency departments and inpatient beds. We are not necessarily seeing a spike in the very ill like we saw in the fall, but we are seeing a surge in people who may not need ICU care but do need support in emergency departments or in the hospitals. And this is where the real pressures lie and is currently our focus. I want to talk briefly about the capacity of our healthcare system and what we can do to make sure anyone who needs hospital care receives it, regardless of whether they have COVID or not. As with all waves, AHS continues to do all that we can do to ensure we have enough hospital capacity to meet the patient demand. Provincially, we have about 8,500 beds in our system, of which about 6,300 of them, called medical surgical beds, are equipped with the staff, space, and equipment necessary to care for a typical COVID patient. These types of beds are in communities all across Alberta, And while most towns do not have ICU beds, many will have acute inpatient beds. And in very general terms, these beds would be used if you needed a hospital stay. Acute care occupancy is always fluid. In urban centres like Calgary and Edmonton, it can be as high as 90 or even over 100% at any given time, while in rural areas, acute care occupancy can be more labile. Currently with Omicron, we are seeing an overall inpatient occupancy increase in most areas of the province. And while we still have capacity with our existing beds, we are now working hard to increase the capacity even further. We have added an additional 278 net surge inpatient hospital beds, and we have repurposed 883 existing beds so that they can be used for patients with COVID as needed. This does not include ICU beds or specialty beds. And while patient numbers are fluid, there are currently 5,334 non-ICU patients in these acute care hospital beds. That means that provincially, non-ICU inpatient occupancy, including additional surge beds, is currently at 89%. And without the additional surge spaces, provincial ICU occupancy would be at 93%. This can change really quickly. For example, this past weekend, the number of Albertans needing hospital care increased by almost 100 people. Our internal early warning system tool shows that we can expect hospitalization numbers to keep increasing for a while yet. And while these patients may not require the complex ICU care, it is still really important to remember that for most people, being in a hospital is a challenging, a difficult, and emotional experience. We need to keep that in mind when we talk about these numbers. So we are taking measures to increase capacity while also ensuring we have the staff and resources to meet that demand. We proactively planned for a contingency acute care inpatient spaces in both Edmonton and Calgary in earlier waves, and you've heard the Premier call these as pandemic response units. We received funding from the Government of Alberta to retrofit shelved spaces we had at South Health Campus in Calgary and the Edmonton Kaye Clinic. These spaces are available when required on an urgent basis, contingent, obviously, on staffing availability. And in the incoming days, we will be activating some of these beds. As mentioned, the Kaye Clinic unit will open 18 beds in the coming week, with plans to open another 18 beds the week of January 31st. South Health Campus unit will open 12 beds initially, with plans to open another 12 beds. And we will only use these beds if we have to, and going forward, additional beds will be opened as needed and as staff availability allows. This temporary measure is one of the initiatives that will ensure that our healthcare system can meet increased demand caused by COVID-19. Patients moved to a PRU can be recovering from COVID-19 and deemed to be at a low risk of transmitting the virus, or they could be patients with less complex healthcare needs than those being cared for in traditional acute care beds. We cannot just simply open more beds. However, it is not as easy as that. You've heard already the challenges that we have with our workforce. And it is more of a challenge now than it has been at any other time during this pandemic. Our teams are understandably exhausted. And as I mentioned, many of them are off sick or isolating themselves or at home caring for their loved ones who are also sick. I've been following our absenteeism rate on a daily basis and note that it has been higher with Omicron. About 5% of our staff are sick at any one time right now, and provincially that comes out to about 5,500 staff. This is having an impact on our ability to fully staff our units and wards, and we know that at given any one day that about 18 to 20% of shifts are being missed due to staff calling in sick or having to cancel due to other challenges, such as sick family members, and that is very, very high for us. We generally run about 15% of shifts missed, so we are seeing more shifts missed in recent weeks. We knew that Omicron would impact our staff. With such high COVID case numbers in the community, this was expected. And although these numbers provide only a snapshot in time, this is why we have been putting additional efforts into bringing on additional staff, as well as increasing staff redeployment. We are also having to deliver healthcare differently. In order to meet current patient needs, when necessary, we're using an alternate model of care. This means instead of having individual healthcare providers caring for a smaller number of patients, a team that together has a complete skill set and relevant experience collectively cares for a group of patients. In this very challenging time, this is the best way skilled healthcare teams can meet the needs of Albertans. Our staffing models will always be guided by safety, a team approach to care, and ensuring that staff with the right skill sets and experience are involved in looking after Albertans. Care teams may also have more students than usual. They are supervised but may be doing important support tasks in order to enable more senior members of the care team to focus on other clinical needs. And we are so grateful to everyone for stepping up to help. Care teams may also have nurses and physicians that are from other areas and may not be as familiar with the area that they have been reassigned to. These changes are the result of us having to ramp up the number of beds available to look after Albertans after 2 long years of intensity on the front line. We are so grateful to our team members, our healthcare workers, our physicians, and I personally want to thank you, because saying it too many times is really not enough. I see the work that you're doing, the ongoing stress, and I'm extremely appreciative. Lastly, I want to address the question of surgeries. I know that there's been a lot of concern about the possibility of further surgical postponements, and just last week we were completing approximately 99% of normal surgical volumes. This week we know that the postponements that had to be reduced surgical volumes to closer to about 90%. We are doing all that we can do to complete as many surgeries and procedures as possible, but we have had to start postponing a small number of surgeries as we did in previous waves. To those Albertans who have had surgeries or procedures postponed, I'm so sorry and understand how difficult it has been for you and your loved ones. But this has been necessary to allow us to create and increase the hospital capacity. It is also necessary due to the impacts of staff illness. Edmonton and Calgary zones began postponing some scheduled surgeries yesterday. The numbers are much smaller than we have seen in previous waves. However, it is likely that they will increase. We're also having to postpone some scheduled surgeries in Central Zone and North Zones depending on physician and staff availability. This is very difficult news to share. I understand the anxiety, the concerns, and frustrations that every delayed surgery creates for their patients and for their loved ones. And again, I'm sorry that we find ourselves in this place again. We will continue to prioritize urgent surgeries and procedures, as well as cancer and pediatric surgeries. We do not take the decision to reduce surgeries and procedures lightly and are well aware of the health implications that any delay in treatment can cause. As with previous waves, it may be necessary for us also to transfer patients to other healthcare or continuing care facilities, to other communities or zones, in order to ensure that all patients get the care that they need. And while effort is being made to accommodate a patient and family preference, this is not always possible given current systems pressures. Please know that this healthcare system is here for you. We're doing all that we can for Albertans, and this commitment has never wavered. It's important for people to know that while our system is definitely stressed, we continue to provide a high level of care to anyone who needs it. Yes, we are seeing disruptions to services, but by and large, the vast majority of services are being provided without fail. The next few weeks are going to be very difficult, but the healthcare system is working, it's safe, and it's there for Albertans. And as with other waves, we also need your help. Strongly urge all Albertans to get immunized as quickly as you can. Please don't hesitate. The vaccine works. It protects you, it protects your loved ones, it protects our communities, and it protects our healthcare system. Please think of the greater good. We need your help in order to ensure that we are there to help you. And please follow the restrictions. Most importantly, stay home if you feel unwell. We need to reduce transmission, and we all need to do that together. As always, I want to extend my sincere, heartfelt thanks and gratitude to all of our incredible healthcare workers who continue to give it their all each and every single day. I'm proud to work with you, and Albertans are lucky to have you. So thank you, and I'll pass this over to Dr. Hinshaw.
Thank you, Dr. Yu, and good afternoon, everyone. Turning to today's numbers. As the Premier mentioned, over the last 24 hours, we have identified 3,527 new cases of COVID-19 and completed about 11,000 tests. Our positivity rate is about 33%. Sadly, 8 new deaths have been reported to Alberta Health over the last 24 hours. These individuals were between the ages of 56 and 93 and leave behind family, friends, and communities. My thoughts are with their loved ones and anyone else who's grieving a loss right now, no matter the cause. Each life lost to this virus reminds us that COVID-19 still presents a real and present threat in our province. As you have heard, over the past few weeks, we have seen an increase of hospitalizations in all age groups, and this includes children as well. I know this can be concerning for parents and families, especially since throughout the pandemic, children have made up a very low proportion of hospitalizations. This continues to be the case, with 4% of those who are currently in hospital with COVID under the age of 18. As with other age groups, some of these children have been admitted for treatment of COVID, while others are being admitted for other reasons and happen to have a COVID-19 infection. Thankfully, evidence from other jurisdictions indicates that individually, children have a lower risk of hospitalization for Omicron infection than Delta. However, the extremely high volume of cases means that more children are needing care right now. This is particularly true for those under 1 who have always been the childhood group with the highest risk of severe outcomes from infection. This is still true with Omicron. Over the entire pandemic, children under 1 have had a similar risk of needing hospital care for COVID as adults age 40 to 49, which is dramatically higher than any other childhood age group. Immunization in pregnancy and immunization of all adults and other eligible children in contact with infants is an important way to protect our young ones. This is yet another example of why it is important to do everything we can to slow transmission in our communities, get immunized, and stay home and away from others when we are sick, especially away from those who are too young to be immunized. As the Premier noted earlier, it's good news that Health Canada has authorized a new prescription drug product for early treatment of COVID-19. Our initial supply will be very limited, so it will only be available by prescription at a small number of community pharmacies across the province. We are reviewing Health Canada's guidelines and working with clinicians to determine eligibility criteria in Alberta. We want to make sure the drug goes to those who will benefit the most, especially early on when the supply will be limited. We expect eligibility will be very similar to the monoclonal antibody sotrovimab, including adult Albertans with symptomatic COVID infection confirmed by testing who are at high risk of progressing to severe disease. We are working to develop the right pathways for Albertans to access both testing for confirmation of COVID and connections to healthcare professionals for a clinical assessment and prescriptions if appropriate. For example, patients with kidney disease or for whom other medications interact with Paxlovid may not be able to take this medication, and that assessment is important. It's important to be as efficient as possible with these processes, considering the importance of getting these drugs to those who will benefit from them within 5 days of the onset of symptoms. We will share this process information as soon as we can. In the meantime, we ask Albertans to please not call their pharmacist or physician's office until more information is released. Your pharmacist and your physician will not have any additional information for you or access to Paxlovid before then. I would also like to stress in the strongest possible way that this treatment is not a substitute for vaccination against COVID-19. Unlike Paxlovid, vaccines are widely available across the province for anyone 5 years of age and older, and you don't need a prescription to get a vaccine. The best thing you can do to protect yourself and others from COVID-19 is to be vaccinated with as many doses as you're eligible for as soon as possible. As our hospitalizations rise in this 5th wave, I'm hearing questions about the vaccination status of patients being hospitalized because of COVID-19. It's important for anyone reviewing hospitalization numbers in the province by vaccination status to remember that the number of vaccinated people in Alberta is many, many times higher than the number of unvaccinated people. With the exponential spread of Omicron, more people are getting sick than at any other point in the pandemic, so it is not surprising to see an increase of hospitalizations, even in some who have been partially or fully immunized. However, as the data shows, immunized individuals are at much less risk of getting severely ill. For example, in the last few months, those who are age 80 or older who have had 3 doses of vaccine have had a lower risk of hospitalization from COVID than unvaccinated 12 to 29-year-olds. Looking at all age groups combined in the last several months, those who do not have any vaccine protection were 15 times more likely to be hospitalized than those with 3 doses, and 7 times more likely than those with 2 doses. If we look at our current data, the majority of people experiencing the most severe outcomes and being treated in intensive care right now are unvaccinated, even though this group represents a minority of the total population. Specifically, unvaccinated individuals make up only about 10% of Alberta's 12-plus population. However, unvaccinated people make up over 57% of ICU patients right now, almost 6 times their share of the population. This shows us that vaccines, especially 3 doses, are very effective at preventing severe illness and death. That's why I continue to urge every Albertan 5 years of age and older to get all vaccine doses they're eligible for. This will not only help to reduce their risk of severe outcomes from COVID-19, it will also help ease the pressure that is building on our healthcare system and help every Albertan to access the care they need when they need it. Thank you, and we're happy to take questions.
And doctors, that concludes the speaking portion of today's COVID update. There's quite a few of you in the queue today, so please keep your questions as short as possible. And just a reminder, the Premier, Minister Copping, and Doctors Yu and Hinshaw are available for questions. Operator, can you please put through the first caller?
Thank you. Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I'm wondering, as we see hospitalizations for children go up and the rate of absent students go up at school, how children fit in this new crunch plan at the hospitals? How will their treatment be affected?
I think, Doctor, you might be in the best position to respond.
Or Dr. Hinshaw about schools.
It's about how pediatric hospitalizations will be accommodated?
Yeah, so right now, what we've been doing in terms of following the pediatric cases is that absolutely, as Dr. Hinshaw mentioned, due to the increased number of children being infected overall, we are seeing a slightly higher increase in hospitalizations. The numbers are relatively still small. Right now we have about, I think, 38 children in the hospital. Obviously, each hospital is serious, and don't underestimate the stress and the trauma that these children have when they are hospitalized. But right now, we are able to absorb any COVID hospitalizations for pediatrics.
Thank you. And Carrie, do you have a follow-up?
Yeah, I'm a little confused on sort of the broad strokes of the situation. Premier, when we hear you talk about how, we're at the peak or past the peak, and this won't be as bad as the last wave because it's not as intense on ICUs. When we hear Dr. Yu speak, what are we to make of this? There's sort of almost competing narratives.
Well, I think you perhaps slightly mischaracterized what I said. I said that there are some hopeful signs, but also a need for ongoing caution. We see that our wastewater data shows declines in 14 of 19 locations across the province. Most importantly, the big cities. We have seen the stabilization and some early signs of a reduction in the positivity rate. And we also know that the typical Omicron wave around the world has lasted about 4 weeks. We're now into our 5th week, going into our 6th week. So I think you take all of those things together, and it's reasonable to infer that we are at or recently passed the peak of infections. And when I talked about less severe impact on the healthcare system, I was really stressing the ICU impact. As you'll recall, during Delta, with much fewer active cases, we ended up with, I think, peaking at nearly 330 total ICU patients. We're at 200 now. We have just a little over 100 with COVID. 30% of whom are incidental COVID cases. And from the latest data I've seen, about half of the COVID ICU cases are Omicron. So assuming that almost all of our new hospitalizations are Omicron related, we can, I think, expect to see, as other jurisdictions have, a relatively low, a significantly lower impact on intensive care than earlier variants, particularly Delta. But I did go on, Carrie, to point out that there is significant pressure on the non-ICU side of the system with over 1,000 hospitalizations. I said I fully expect to see over 1,500. Again, 45% of those are incidental cases. But all of this is complicated by the fatigue of our fantastic healthcare workers and an increase in those who have had to self-isolate. That increase is impactful, but it's not as bad as we've seen at other points in the pandemic. So I'm trying to provide a balanced perspective, which is to say that there are some very significant pressures. That's why I'm asking Albertans to continue to be diligent. Yet I am hopeful, as we've seen in other parts of the world and other parts of Canada hit earlier by Omicron, that we'll start to see the case numbers come down, the positivity rate come down, and eventually that probably means peaking in healthcare use later this month, and then hopefully a decline in healthcare pressure.
Thank you, Premier. Operator, can you please put through the next caller?
Thank you. Andrew Lawton, True North.
Good afternoon, Premier. You raised, I think, a very important question and answered it earlier about how long we will be saddled with restrictions, but I'm hoping to get a bit more detail from you than just very soon for lifting them. We had in Ontario, for example, a roadmap updated today that has by March still no revocation of mask mandates, no revocation of vaccine passports. Realistically, how long are you prepared to keep those two things in place in Alberta? And to get more specific with it, what are the metrics that you'll use to inform when to lift those?
Well, we won't consider lifting the current measures until we see a sustained decline in pressure on hospitalization. That would follow a sustained decline in new cases, of course. So, I think it would be fair to say, Andrew, that if we expect to see hospitalizations peak towards the end of this month, beginning of February, that we need to see sustained decline in that hospital pressure before we could move forward with considering relaxation of measures prudently. Look, I would just point out, Andrew, that Alberta, like much of Western Canada, has maintained much less severe restrictions than parts of Central and Eastern Canada. And yet we have so far been less severely impacted by Omicron. There may be a lot of reasons for that. We had a bigger Delta wave here that may have created more people with immunity from prior infection. There may be a lot of reasons for it. But what I can tell you is I am eager for us to be able to stop some of these incredible intrusions in people's lives. And increasingly, I think that the data we're seeing around the world points hopefully to the ability to do that. But we've got to stick to our knitting right now. We are at our, we are expecting probably a few hundred more people in our hospitals with COVID, so it's too early for us to plan for relaxation of measures at this point.
Thank you, Premier. And Andrew, do you have a follow-up?
I do. You've been very clear, Premier, that you will not advance the vaccine mandate. You've been very critical of the Quebec government's attempt to exact a health contribution, as they call it, a fine on the unvaccinated. Yet you were also unequivocal when it came to criticizing the idea of vaccine passports before you implemented those in Alberta. So, where's the accountability measure to ensure that if things don't get bad, this may not be something that is on the table in Alberta?
Fair question. I would point out that every premier, including the Prime Minister, were opposed to proof of vaccination requirements in the spring. Our collective experience on Delta hit us hard, and for us, the alternative to shutting down businesses was a proof of vaccination program. When it comes to the Quebec policy, I spoke very bluntly about that last week. I would just point out, Andrew, that our government, through the legislature last year, repealed the power for the government to force mandatory vaccination on people. And that's a power that had been in the law since, I gather, 1910. So we took that out of the law. We no longer have the power, should any government in the future want to, God forbid, to take away people's bodily autonomy in that way. In terms of the healthcare levy, or whatever Quebec is calling it, again, I just think this is, what can I tell you? I'd be happy to propose a law in the legislature this spring to say that this is not legally possible in Alberta. To me, the idea of sending people a bill effectively, even if it's indirectly doing that for their health care, is a total violation of the universality of our publicly funded system. And, you know, when we have people who make bad life choices, when we have people with drug addictions who show up in the emergency ward frequently, we don't ask for their credit card, we don't send them a bill, we do the compassionate thing, we don't judge them, we care for them. When a drunk driver shows up at the hospital, the same thing. When, you know, a criminal gets into a fight and gets injured, they show up at the hospital, we don't judge them because of the choices they made, we care for them. That's the Canadian system, that's certainly the Alberta system, and as long as this government's in office, it will continue to be.
Thank you, Premier. Operator, can you please put through the next caller?
Thank you. Carolyn Dunn, CBC.
Thank you very much for taking my question. This is a little off topic from COVID, but we have been told that senior members of your staff and cabinet knew about the Minister Madhu distracted driving ticket the day after it happened. And I'm wondering if you can tell me, when did you know and why wasn't it addressed sooner?
You know, I do recall at some point last year hearing that Minister Madhu had gotten a ticket, had paid for it. I got fully briefed on all of this, including about the call and the details on Monday afternoon following media inquiries. Shortly thereafter, I called Minister Madhu to ask what happened from his perspective and why he made this call. I expressed my serious disappointment that he would have done this. He said to me essentially what he has said in his public statements. I asked my Chief of Staff to call Chief McPhee to get his account or recollection of this call that he had received from Minister Madhu. And again, my understanding is he said essentially the same thing to my Chief of Staff as he said publicly in media reports. Now, because the Chief has said that, well, just to quote, he said, quotes, "To be very clear, he never asked me about the ticket. His concern about what was happening in Lethbridge, concern around what was going on in relation to people of color being stopped." Because of the context of some of those issues, I reached out to a number of respected former leaders in the judiciary, in government, and in policing on Monday afternoon and evening to get their advice on how best to address this. And the consensus of the several people with whom I spoke, the respected former leaders of government and the judiciary, was that having a third-party investigation to identify exactly what happened would be the right approach to determine whether there was any effort to interfere in the independent administration of justice. And that is why I announced on Monday that we will be appointing a independent investigator to look into exactly that question. We have drafted terms of reference. We have contacted some former members, respected members of the judiciary, to see if they would have the time to assist with this kind of investigation. And I hope to be able to have more to report on that in the very near future.
Thank you, Premier. Carolyn, do you have a follow-up?
I do, actually. So the review is one thing. What would the consequences be if wrongdoing is found? And why didn't you just fire him right away and then reinstate him if he is cleared in some review?
Well, I've looked at precedents such as this where, you know, when I was Minister of Defense, for example, and we had a senior officer with serious allegations made against them, the typical response would be to put that person on a leave of absence, conduct an investigation to determine the facts, and then to make a final decision about their situation. I think that is normal in a context like this. Let me say this. If Chief McPhee had alleged that he felt this was an interference in the administration of justice, in the independence of the police, or an effort to rescind the ticket, if I would have made a immediate decision to remove Mr. Madhu from cabinet, but that's not the public statement that we have. Questions have been raised about profiling. I was not on this call. I was not present at the time that this ticket was issued. And I think, given the issues that have been raised, it is appropriate to allow for a little bit of time for an investigation from somebody with legal training who is impartial to provide me with advice on whether this constituted an effort to interfere in the independent administration of justice. So that's what we're doing. As I said, I reached out to a number of nearly a dozen senior former members of both the judiciary and of government to get their advice, and that was the consensus view of the people who gave me advice last Monday. And I think, it's conventional with similar circumstances that I've seen.
Thank you, Premier. Operator, can you please put through the next caller?
Dylan Short, Post Media.
Hi there. I'd like to go back to children in hospital. I know that they still represent a smaller number than their older counterparts, but between December 31st and yesterday, it looks like there were 160 admissions for children under the age of 19. The same time frame from last year was 35. So I guess my question is, given the increase in the number of children that are going to hospital with COVID, what's being done, I guess, to protect this population, especially given the fact that they aren't eligible for a booster shot yet?
So perhaps Dr. Hinshaw, Dr. Yu?
So I can speak to population protection, and I just want to make sure I understand. So you're speaking about the under 5 population, or you're speaking about the under 18, or I guess it would be the under 12 population who would be coming due for their second doses in the next several weeks, or all of them together, just to clarify?
Yeah, sorry, I guess all of them together, but especially for the individuals that haven't been able to get fully immunized yet.
So absolutely, the number of children currently in hospital, as Dr. Yu mentioned, each of those children would have a significant impact on them and on their family, and that should not be discounted. It is also true that the percentage of cases that are going to hospital, when we look at the evidence around the world about Omicron, is a lower risk. This is unfortunately the consequence of the significant transmission we're seeing right now. It's absolutely critical that anyone who is in a household with or interacts regularly with someone who is in this younger age group receive their vaccines as soon as possible. It's clear that children who live in a household where all adults are fully immunized have a lower risk of ending up in hospital than children who live in a household where not all adults are fully immunized. It's also true that those children under 1 have the absolute highest risk of all childhood age groups. And it's really important that those who are pregnant access the protection of vaccine for themselves and for their children. It's also critical, again, that all of us do everything we can to minimize transmission in the community so that we can lower the chances of children being exposed. But we do know, again, that the higher numbers are due to the higher transmission that we're seeing right now, and that protecting kids is really something all of us can do together. The last time I looked at the data, I didn't see that any children with a single dose of vaccine had been admitted. So even in that 5 to 11-year-old age group, it's important to note that at least the last time I checked, we hadn't seen any kids who were at least partially vaccinated ending up in hospital. It is, of course, important for those children to receive their booster, and most who were early in the first dose will be coming due for that very soon. So I encourage those parents to get their kids fully vaccinated in that 5 to 11-year-old age group. But again, it's the vaccination of those around them that is going to really be important at minimizing risk.
Thank you, Doctor. And Dylan, do you have a follow-up?
Yeah, I do. I'm not sure who this would be directed towards, but in recent weeks, past month or so, we've seen the rollback of PCR testing, so children can't receive those. If they may have access to rapid tests through their schools, but many still do not. There's now no school outbreak reporting online, at least officially. I'm hearing from a lot of parents that they feel that they can't make safe decisions for their children. I would like to get a response to that, to parents that feel that they can't make an informed, safe decision on what's best for their children.
We've been used to having access to PCR testing for mild illness in all age groups for almost 2 years. And so it's really difficult when we've been used to having that access, when we've been used to having all of the outbreak data, all of the case data. The shift that Omicron has required us to make is difficult, especially over a short time period. So I sympathize with parents who want the kind of information they used to have. What is important to understand about our current Omicron wave is that even though, again, our cases may be at a plateau right now, transmission is incredibly high. So if parents are trying to decide what activities their children should engage in, they need to understand that there's a high likelihood that there could be someone infectious at almost any activity their children participate in outside the home. Which is exactly why in schools we've ensured that there are additional levels of protection with medical masks and regular access to rapid testing for asymptomatic screening in that context. And it is important for parents then to understand they need to make the risk-based decisions that are appropriate for their family based on community spread at this time, because we simply must use our access to testing for those who need it for clinical reasons and for those high-risk settings where the risk of severe outcomes is very high, such as long-term care.
Thank you, Dr. Hinshaw. Operator, can you please put through the next caller?
Brianna Carson-Schmidt, Global News.
Hi there. I think my question is for Dr. Yu. Dr. Yu, I'm asking about the, backfill for your staff in order to fill these beds in this new phone line. We're hearing that corporate or out-of-scope staff will be taking on some other duties. Can you talk about that? And then I guess for the Premier, why aren't you asking either other provinces or the military to step in and also bring in extra hands?
Yeah, so in terms of the first part of the question, absolutely. Anybody who has any clinical experience, no matter what position they work in within the organization, we're actually asking for their skill sets, what they've done in the past, and finding appropriate redeployment positions for them. I just want to say thank you to our teams who have been redeployed for over 2 years, and just to say it's very difficult to be redeployed into areas where you're not familiar with. And, you know, our teams have just continued to go above and beyond the call of duty all the time when it comes to staffing. So I just...
The second part of the question, which was, why have I not called upon the Canadian military or other provinces to help us out? Well, the answer is that every province is stretched thin right now for exactly the same reasons. In fact, Alberta has a lower per capita rate of hospitalization from COVID-19 than Canada as a whole, and much lower than, for example, Ontario and Quebec. So other provinces do not have spare capacity. They're all stretched, as has every part of the world. I mean, even the U.S., which spends a lot more on healthcare and has relatively more healthcare workers per capita, even many of their hospital systems have been stretched for the same reasons. And in terms of the Canadian Armed Forces, the Canadian Armed Forces, as I've pointed out before, has extremely limited health capacity. They don't actually run a hospital system anymore. That ended about 25 years back. And when we did call on the forces through the federal government for some help back in September for Delta, they were able, I think my recollection was to provide 9 nurses, which helped us to maybe staff 1 or 2 beds in ICU. So, and those assets those individuals have been redeployed to provinces that are harder hit. So the feds, with their very limited healthcare assets, have to go to where the needs are greatest. I think right now that would be Quebec, which despite its curfew and lockdown policies has been hardest hit province in Canada from Omicron.
Thank you, Premier. Operator, can you please put through our final caller?
Thank you. Audrey Neville, Radio Canada.
Hi, thank you for taking my question. I'll just start with a question in French on something you've already been asked on the fifth wave. Monsieur le Premier ministre, pouvez-vous nous expliquer un peu mieux, c'est quoi votre vision? Est-ce qu'on a dépassé le sommet de la 5e vague? Parce que on a l'impression que vous et vos collègues avez envoyé des messages un peu contradictoires. Éclairez-nous.
Merci. Il y a des preuves initiales, il y a des preuves tôt que nous voyons une diminution des cas avec une diminution de COVID-19 dans le système de wastewater, également dans le taux de positivité. Et tous les autres pays et provinces ont vu une diminution des cas de Omicron après une délai d'environ 4 semaines. Alors, nous sommes 5 semaines depuis le début de vague de l'Omicron. Alors, je crois que c'est raisonnable à conclure que nous avons atteint le sommet des cas des infections de Omicron maintenant. Mais il faut le voir parce qu'évidemment, il y a un délai entre le maximum des cas et le maximum de pression sur le système de santé. Alors, je m'attends à ce que plus de pression sur les hôpitaux pour les prochaines 2 semaines, plus ou moins. Je crois que c'est tout à fait possible que nous aurons plus de 1500 hospitalisations avec COVID-19. Cela étant dit, presque une moitié des gens dans les hôpitaux avec COVID-19 actuellement sont les cas non primaires, ça veut dire ils sont aux hôpitaux pour les autres raisons de santé, pas pour COVID-19. Alors, dans ce sens-là, particulièrement dans les soins intensifs, il y a moins de pression que dans les autres vagues auparavant. Alors, il y a des pressions, c'est vrai. C'est la raison pour laquelle j'encourage les Albertans à continuer d'être prudents, mais j'espère que nous pouvons voir d'ici les semaines à venir une situation de diminution de l'Omicron.
Thank you, Premier. And Audrey, do you have a follow-up?
Yes. Vous dites, vous pensez qu'on pourrait avoir jusqu'à 1500 hospitalisations, ça c'est beaucoup plus que ce qu'on a eu dans le passé. Quelles mesures est-ce que vous pensez prendre de plus que ce que vous avez annoncé aujourd'hui, notamment peut-être appeler l'armée? Est-ce que c'est quelque chose que vous considérez en ce moment?
Aujourd'hui, nous annonçons les mesures supplémentaires dans le système des hôpitaux pour mieux gérer les pressions. Par exemple, nous ouvrirons les sections des hôpitaux pour les patients supplémentaires, les COVID care units et également les pandemic response units, les unités de réponse aux pandémies. Et également, nous créons les équipes spéciales des travailleurs dans les hôpitaux pour s'adresser aux patients qui n'ont pas les symptômes trop graves. Et finalement, nous travaillons avec le réseau de soins primaires, Primary Care Networks, pour créer les cliniques de COVID-19 communautaires pour aider les gens qui ont le COVID mais ne doivent pas être hospitalisés, pour réduire la pression sur les hôpitaux. Alors, ils sont les stratégies pour s'adresser à une pression croissante, mais je crois que nous voyons, comme j'ai dit, des bonnes nouvelles et en même temps, il faut être prudent, c'est ce que nous faisons.
Thank you, everyone. That concludes today's press conference.